let's talk about what is not in the health care bill. All right? I promise you there is no public option in the bill. There's no government-run health insurance plan that is going to take over all the insurance companies. We managed to strip that part out of the bill. It was in one version, but it's not anymore. There is no provision that says if you don't buy government-regulated health insurance, then you're not allowed to buy any insurance at all. Now, if you don't buy insurance that they deem to be acceptable, there will be consequences for that, but you can still do it. So private insurance is not outlawed. There's no price controls on prescription drugs. There was an amendment to create them. It didn't pass. And health savings accounts are not outlawed. They were outlawed in one version of the bill, but in the bill that passed, you can keep your health savings account if you have one. It just won't be as good. There's also another side of a coin of things that are not in the bill. You may have heard that there is tort reform or medical liability reform in the bill. Not really. You may have heard that the bill would allow small businesses new pooling options. Not really. Not the kind that we want. You may have heard that the bill would allow small businesses or individuals to purchase health insurance across state lines. For instance, from a state like Arizona that has much fewer health care mandates and cheaper plans. Not really. There are some efforts to curb fraud and abuse in the bill, but most of the efforts that were talked about, the ideas that were brought up later in the game, not in the bill. And then there is no tax fairness for the self-insured, for the self-employed, although it looked like from the size of the companies in this room, that's not as big a worry here. But there are some things that the White House would not like to talk about that are in the bill. For instance, there is a rationing body in the bill. Its job is to ration care in the Medicare program. It's called the Independent Payment Advisory Board, and we can talk about that later, but there's no question about it. Its job is to ration care. There are mandates both on individuals and employers. So if you're an employer with 50 or more employees, there is a mandate on your company. And if you're an individual who makes above the poverty level, basically, there's going to be a mandate on you to have health insurance as well. Is Nancy Pelosi and Harry Reid, are they going to be on the same plan as everybody else? No, they are exempt. Now all the other Congress members will be on your plan, but committee staff, the people who wrote the bill, and leadership, Nancy Pelosi and Harry Reid, they're exempt. They get to keep the plan that they have right now. That's why what we have is it's an interesting, complicated thing, because generally the time when you fix legislation is in a formal conference committee. When you're going through line by line, well, do we take this line from the House or this line from the Senate? And they didn't do that. They couldn't do that. It wouldn't have worked. And what that means is I've already found 36 places where the bill contradicts itself. I mean, this is something that's going to be very difficult and it's going to take a long time to correct. There's going to be technical corrections bills passing through the House and Senate for years to come. And the implementation timeline is a long ways away too. I mean, there's stuff that happens on September 23rd or the first plan year after October. There's stuff that takes place on January 1 of next year. But the big changes, like the mandate on employers, the big changes like the Cadillac tax on high-value plans, those don't take place until 2014, even 2018. Think about it for a minute in D.C. perspective, okay? 2018 is 4 elections away. We're talking about, even if President Obama wins re-election, he still won't be the president when this so-called Cadillac tax is implemented, meaning that you're going to have an entirely new Congress and a new president whose job is suddenly going to be to implement $1 trillion new tax. That's a very good way to get very unpopular very quickly. So we don't think that some of these provisions that take place down the road are ever even going to happen. Now there's other provisions that we think probably will happen no matter what. There's nothing you can do. You're going to be adding my slacker brother who lives in my mom's basement to your health care plan. You have to do it. There's nothing that you can do. You are absolutely going to be covering preventative services at 100%. Stuff that's getting implemented right now, you're never going to roll that back. But stuff that's up in 2014, that's up for grabs. Taxes on pharmaceutical products, prescription drugs, taxes on medical devices, taxes on higher income individuals, taxes on health insurance policies. These things don't get implemented right away. We have time to push back because at the end of the day, remember, who pays all of those taxes at the end of the day? You do. At the end of the day, the Congressional Budget Office has been very clear. When you put a tax on a prescription drug, the prescription drug company raises their prices to the provider raises their prices to the insurer raises their premiums to the consumer, and you don't have anywhere to push that cost. So you pay it. And at the end of the day, almost all of the $569 billion in new taxes of the bill will be paid by consumers. And that's to say nothing of the more than $500 billion in cuts to public programs that may well lead to cost shifts to increase costs even more for consumers. So the idea that health reform is somehow done is silly. Health reform has only begun, and at the end of the day, it becomes incumbent upon the business community to push for several things. One, to roll back the worst parts of the bill. Two, to make sure that the bill is implemented in a way that doesn't hurt businesses any more than it has to. And three, to make changes to try and prevent some of the things that would lead to physicians and providers going out of business, insurance companies not being able to provide products that make sense to us. It becomes our job to implement cost controls in the bill. But I can tell you right now, there's all kinds of ideas. In fact, in December 2008, the Congressional Budget Office published a massive, more than 200-page document listing all of the different ways that we could try to control costs in the healthcare legislation. Hardly any of them are actually included. Now, there are some cost control things included in pilot projects and smaller things, but when you're talking about the broad swath of all the different cost control ways that you can try and lower the cost of health insurance, they're just not in there. The Congressional Budget Office said straight up, if we were to allow people to purchase health insurance across state lines, we could lower health insurance costs by 5% instantly. If we were to allow small businesses to pool together and form their own ERISA pools with whoever else they wanted to pool together with, you would instantly save money not only for the federal government, but for the state governments too, because people would come off of Medicaid and into employer plans. But that's not the approach that this bill took. We're going to cover 30 million people, but it's important to know how those people are going to be covered. About half of them are going to be covered because they're getting subsidies, wealth is being redistributed to them, or they're being forced to purchase coverage through the individual mandate, and about half of them are going to be covered under the Medicaid program, which creates a cost shift to employers. In other words, Medicaid doesn't pay doctors and hospitals fairly. In fact, public programs don't pay doctors and hospitals fairly at all. Yesterday, doctors' payments for Medicare were cut by 21%. I'm not saying that that's really going to stay, but the fact is that doctors know that they're not going to be paid fairly by those programs, and they have to make it up from somewhere, and the only way they can make it up, and the only place they can go, is to you at the end of the day. I know I've got to wrap up here. The last thing that I just wanted to say is that the financing for this program is the slipperiest, the ricketiest part of this three-legged stool. Okay? The president arbitrarily said that the bill cannot exceed $900 billion in costs. Well, we're already up to about 1.1. We've gone up over 100 billion more than he said it should cost, and that's just by the CBO's rosy projections. If I made calculations the way the CBO does, I would not just be fired, I'd probably be prosecuted. There are pieces in the bill that would make Bernie Madoff proud. Go on the internet and look up the Class Act and you will understand. There are parts of the bill that straight up say we are going to cut payments so much that the Center for Medicare and Medicaid Services said, yes, if we go through with these parts of the bill, 20% of doctors and hospitals will become unprofitable and probably go out of business. That could never happen. We would never allow that to happen. We're going to add 30 million people to the ranks of the insured. We can't have 20% of doctors going to the ranks of the unemployed. So, you're looking at this financing and you've got to realize that it's just not going to work. The Cadillac tax that's supposed to raise $1 trillion in the second 10 years, it's probably never going to be implemented. So when you look at this, we've created a new $500 billion entitlement. And how are we going to pay for it? So our challenge, as this thing is implemented, specifically in 2014, when the big spending provisions are implemented, our challenge is to try to prevent ourselves from becoming the next Greece. Because this bill paves us into a way that we could possibly get there if we don't make more changes, if we don't aggressively go after it.